is International Overdose Awareness Day, the world's largest annual campaign to end overdoses, remember those who've died, and to recognize the grief of affected families. The White House has marked the day with a new investment of $450 million to support overdose prevention and harm reduction efforts. So joining us now to talk about this issue that's plaguing America is Andrew Brown. He's the Director of Events and Communications for CARE of Southeastern Michigan. Thank you for being here with us.
Thank you for having me, Terrence. Appreciate it.
We are certainly glad to have you. I know this is an issue that affects so many different people across the country and world. What is the state of the issue now? Are we going in the right direction, or is it getting worse?
Well, the state we're in right now is really unique. Fentanyl is crippling our communities in a number of ways. Obviously, people know about fentanyl and the opioid supply, like street heroin. But the problem we're seeing nowadays is people overdosing on fentanyl that have no intention of even using opioids. So you're talking people that may use stimulants like crack cocaine, people that are using what they think are over-the-counter pills are actually laced with fentanyl. So we've seen a real unique increase in overdose deaths amongst, younger people, different communities of color, disparate populations really affected disproportionately by fentanyl and the drug supply.
And for someone who's locked in the grip of addiction, it can be a very uphill battle to get out of that. And for people who try to help, sometimes they feel helpless. How do you help people even in that process?
So it is, I'm in long-term recovery myself, and I think it took what it took for me. And I know being today's International Overdose Awareness Day, and this year's theme is actually the people who might not normally be acknowledged. And the theme this year is like people, family, friends, healthcare providers that are affected by overdose and overdose death. I think we always think of the people that actually pass away from overdose, which is awful, but we have all these people there that sometimes I don't think address that. And help is available. I think that's always what I want to put out there, is that, for myself, even Terrence, it took many different things, and it's not an easy answer, but what I can tell people out there is that it's possible. For me, 16 years ago, I would have never dreamed it was possible.
Yeah, thank you for sharing that. And our producer, Bill, we have to give kudos to him for being the visionary of us having this conversation on this day. He has a friend who is now in that same issue now. He's trapped in that world of addiction. People have reached out to try to help, but there's just that thing of every day not knowing if you're going to get that call that it's the worst. How do you help people in that process and not giving up? Because it can be hard to keep trying to reach out, but you're not getting anywhere with it.
It is, and I feel for your friend. It's a terrifying perspective. I buried a good friend last week who died by overdose, and it's just it's heartbreaking. But on the same token, I've seen so many miracles happen, Terrence, in where you'd never imagine possible. And I think it's so hard for friends and family sometimes. It's like we're doing everything, we're pouring our heart and souls out to help this person, and they're still continuing to use substances. And what I can say to your friend or anyone else out there is, keep planting those seeds, keep letting people know you're available. Obviously, have some protective factors for yourself, and get some help for yourself. But let your friends know that you still care about them, even if they continue to use substances.
Now, Andrew, we've had a lot of conversations here on CBS News Detroit about Narcan. We've done some stories on those actually being rolled out in communities. Do you think that's helping at all?
Yes, I without a doubt think it's helping. I think where we were at even a few years ago with the availability of naloxone and Narcan, brand name Narcan, we've come miles, eons, and even CARE alone, I know last year we saved 22 lives with the kits we handed out in the community, because we tracked those kits, and whenever there's a save with Narcan in the community, people report it. So we had at least 22 reported saves of Narcan just in the Macomb County community. So it's working. We know it's out there. It's accessible. It's available. Just search on the internet, Narcan availability in my community, I guarantee you there's either a Dropbox there, no questions asked. Get it in your hands.
All right, Andrew, like you said, we just got to keep the fight going. Again, we thank you for your time.
I really appreciate it, Terrence. Thanks for having me.